Hello and welcome. These two illustrations are from Netter's flashcards of anatomy, where we will be discussing the gallbladder and the extrahepatic bile ducts. The first misconception we need to address off the bat is that bile is not produced in the gallbladder. Rather, bile is produced in the liver, and it is simply in the gallbladder where the bile is stored and concentrated. So the bile leaves the liver by the right and the left hepatic ducts, here labeled as number 4, eventually draining into a common hepatic duct. The common hepatic duct here labeled as number 1. The latter drains via the cystic duct, here labeled as number 2, into the gallbladder. So again, the bile leaves the liver through the right and the left hepatic ducts, eventually traveling through the common hepatic duct. The bile then travels through the cystic duct, eventually entering the gallbladder. When stimulated by autonomic nerves and a hormone called cholecystokinin, the gallbladder will contract, and it will send the bile down via the same cystic duct, and the bile will eventually flow through number 6 here, the common bile duct. The common bile duct, where eventually the bile will exit through the major duodenal papilla, emptying into the descending duodenum. At this location here, the common bile duct will join with the main pancreatic duct, here labeled as number 7, to form the hepatopancreatic ampulla of Vater, the ampulla of Vater labeled as number 8. Again, to recall, the bile is produced in the liver. It will leave the liver through the right and the left hepatic ducts. The bile will travel through the common hepatic duct. The bile will enter through the cystic duct so that it can be stored and concentrated in the gallbladder. When the bile needs to be released, the gallbladder will contract, send the bile back through the cystic duct, eventually traveling through the common bile duct, the CBD, the common bile duct. The bile will eventually meet at this point the pancreatic duct, eventually joining with the pancreatic juices to exit through the ampulla of Vater. The ampulla of Vater exits through the descending duodenum.